Chapter 10, Evidence-Based Practice, Sandra Monk. The objectives of this chapter are to define evidence-based practice and to help us understand the history of evidence-based practice in healthcare. We also want to assess the relationship between evidence-based practice and the practice of nursing within the community, and to provide examples of evidence-based practice in the community, and to look at barriers to evidence-based practice and identify resources for evidence-based practice for the community health nurse. So research evidence provides scientific basis for practice. So using this kind of research supports practice that will result in better client outcomes and more efficient practice also. And nurses at all levels, in fact, it's really encouraged that nurses at all levels be involved in the development and implementation and evaluation of the effects of evidence-based practice. We want nurses solving nursing problems. And, also looking at the perceptions of the nurses, of the patients, of the families, of the communities, as we, help to solve the practice-based problems. And so there's a need for more evidence-based guidelines in public health. There are, public health clinical practice guidelines based on, problems that have been solved where, and there's development, implementation, and evaluation of the effects of those. So those are still very much needed in public health and in community health. Definition of evidence-based practice. On this slide, they talk about evidence-based medicine, evidence-based public health, evidence-based practice, but what it all comes down to really is an integration of the best evidence available of nursing expertise or public health or medical or, whatever type of evidence-based practice you're talking about, but the best evidence available with nursing expertise and the values and preferences of the individuals, families, and the communities who are served. And that certainly does include public health, and you want that to come from a variety of sources, including research studies and nursing experience, although we can't base it all on anecdotal stories like we used to before we started depending more on evidence-based practice. Some of the history related to evidence-based practice goes back to the mid to late 1970s, when there began to be a movement of growing consensus among nursing leaders that scientific knowledge should be used as the basis for nursing practice. And the Division of Nursing began funding nursing research utilization projects. And these three different divisions are organizations that fund research and nursing research, evidence-based practice, and research utilization. And they are Nurse Child Assessment Satellite Training Project, NCAST, the WICHN, or WICI, which is Western Interstate Commission for Higher Education, and the Regional Program for Nursing Education. And then CURN, which is Conduct and Utilization of Research in Nursing Project. And in the 1990s, overall, a paradigm shift began where it was required by, accreditation bodies, insurance companies, all of the stakeholders started saying, we want to see government agencies, we want to see, the evidence on why you're doing what you say you're doing. So, we can support the costs, we can, support, the ethics of it. So the evidence-based practice term became created, and it's used, it's used generically, to talk about, what is done in medicine, but also what is done in nursing. But we need to have systematic, unbiased clinical observations to base our nursing practice on. Some types of evidence. We talk about hierarchy of evidence, and some of that hierarchy, there are certain types that we consider to be the gold standard and to be the most strong evidence that you can find, and that would be systematic reviews of randomized controlled trials. And then below that would be a single, that would be, multiple random clinical trials that demonstrated similar findings that could be generalized to a large population. And then below that would be like a single randomized clinical trial, or a single non-randomized trial. And then down below that would be correlational or observational type studies and qualitative studies. And then below that, opinions and experts of others. So there's certain ways that we judge, that we judge how strong and how good and what is the highest level of evidence. And also we look to incorporate clinical experience and also professional guidelines. So the expertise of nurses is not overlooked at all, nor that of other experts. Factors of implementation of evidence-based practice. First, you need to have knowledge of the research and current evidence. You would need to have that to begin, looking at a problem. So, someone from outside of nursing would need a nurse to guide them through the process if they were in fact going to do evidence-based practice, evidence-based practice research within the realm of nursing. Nursing the same way. If we were to do it, outside of nursing, we would need to, someone to guide us. And also the ability to interpret the meaning of the evidence. Again, nursing research, you need to have, a nurse to be a part of that. And then individual professionals' characteristics, such as, is there a willingness to change, or personal viewpoints about the quality and credibility of the evidence, or do people want to hang on to anecdotal or ways of doing things, which are, like, time-worn, things that nurses have learned. For an example is many years ago, we used to put Maalox on pressure ulcers, and we would rub, areas of redness with that. And of course, now we know that destroys the tissue underneath, but, we didn't have that, evidence, but yet we passed that on, as nurses, that was something that you could do. And I suppose it did provide something with the magnesia. I'm not quite sure what happened there. Hadn't really thought about it. Let's see. Also, time constraints. I mean, do you have the time to do this? And is time made in the clinical setting for people to be able to perform this type of research and investigation? The hierarchy of the practice environment and the level of the support of the managers and the ability to engage in autonomous practice. Is this an area that's very, very regulated? It would be, it could be difficult, to do evidence-based research within the school system because of all the liabilities and protections for children, and also the hierarchy of that. I worked in the VA system, one of the easiest places that I've ever worked, where you could, in fact, you could do some evidence-based practice, but there were layers to go through. So you had to be very tenacious and very determined if you wanted to make a practice change there, because of the hierarchy and bureaucracy that you had to move through. But it definitely was not impossible. We definitely made changes. The philosophy and the practice of the environment, and the willingness to embrace evidence-based practice. And then what kind of resources are available, such as the amount of work, do you have the proper equipment, the computer-based evidence-based programs, information systems, do you have somebody who will help you set up some systems on the IT system? Is it possible to track data, and can somebody help you with that? Somebody there to help you with your statistics that you want to run. The practice of characteristics such as leadership and collegial attitudes. Are there links to outside supports if you need outside support, such as teaching facilities, or like a teaching health department, or a university? Political constraints and a lack of relevant or timely public health practice research. So there can be barriers, and there can be, opportunities, and there can be ways to overcome, each of those. Step 0 is a curiosity about the interventions that are being applied. And this, every nursing research, every evidence-based practice project begins with a hunch that a nurse has about, I wonder why that happens that way, or I'll bet this is causing that. I'll just bet that is a problem. And so what happens is then a PICO question is established based on what is going on with the what is going on with the nursing situation. So we see these clinical type situations all the time, and nurses are the perfect ones to identify these PICO questions and to look at the population, and then they look at an intervention related to that, and continue with their investigation up to the outcome of what should happen with this clinical practice problem. And the first step to that would be to do first thing, the most important thing is to determine what is your question. Do you really have a question that can be, answered, that is answerable using the steps for evidence-based practice? Or, is it, just you haven't quite gotten down to the, to the bottom of it, and you need to do a little more investigation to determine what your problem actually is. Then once you've determined the problem, then you get down and you do a literature search based on that, based on the most relevant information that you can find related to that question. And then critical appraisal of the evidence. Do you have good evidence that is based on your population of interest, your intervention, and then your outcome desired, and so forth. And then you want to integrate that with the clinical expertise of the nurses and the client values. I mean, if you come up with a solution and it's something that would not be agreeable to the population that you serve, then that is not going to be usable. You're not going to be able to utilize that, that evidence-based practice that you have designed and you've discovered and you've designed. And then the evaluation of the outcomes of the practice decisions and changes based on step 4. And then you want to disseminate the outcomes there. Okay, approaches to finding evidence, a systematic review, guides to community preventive services, access to the Cochrane Public Health Group, Center for Review and Dissemination, Campbell Collaboration. It's a summary of research evidence that relates to specific questions and to the effect of an intervention. Or you could look for a meta-analysis, which is a specific method of statistical synthesis used for some systematic reviews, where the reviews of several studies are quantitatively combined and summarized to make sure that you have a good review of your literature. Evaluating your evidence, you want to look at sample size. You want the largest sample size you can have. You want your sample to be randomized if possible. Do you want there to be blinding, or should some people know or not know that they are part of is it ethical in certain situations for a person to know or not to know that they are part of a research study? You want to look at your sample size. I think I already said that, but your sample selection must be very carefully chosen, because you can't change this without going back and getting approval once you get your research started. You want to have a good description of your intervention. You want to think it through very clearly. Think about what kind of outcomes that you're looking for, and then the length of follow-up that you're going to need to perform. Because a lot of times this is going to determine your feasibility of even being able to do the study. Are you going to have the time, the effort, the manpower to be able to do this? You have to build in for attrition for possibly subjects who may need to drop out for whatever reason. If you're dealing with patients who are sick, then that's a possibility, who are ill or who may die or who may go home from the hospital or who may move in the community. So working with the homeless, a population like that, you would have a high attrition rate. Persons who are victims of domestic violence, that is, you may have problems there with keeping people undiscovered in your sample and in your study. Nurses may not have the time. They may think they have the time, and then that they find out that they dwindle down. And then confounding variables, things that are extraneous to the study but that have an influence on the variables within your study. And then your statistical analysis. Is this something that you need to know that ahead of time, how you're going to be able to determine the effectiveness of your outcomes, and what type of statistics that you're going to use. The evidence is assigned as a grade based on the quality of the evidence, and a number of well-designed studies is preferable. And you want to have presence of similar findings in all of the studies, that are going to support what you are going to try to do, the question that you're trying to answer. And 3 domains that you're looking for when you're evaluating, you want to look for quality, quantity, and consistency. And so this is a good concept to remember, that multiple high-quality studies with large sample sizes and consistent findings are your best bet. And patient-oriented evidence that matters, that is, what are the results? Are they important? So there's kind of a so what question with research, and with evidence-based practice. Are the results valid? And how can the results be applied to client care? Because we don't really do research, and we don't really, get involved with evidence-based practice just for the sake of doing it. It is for the sake of actually adding to nursing knowledge and to improving patient outcomes. Approaches to implementing evidence-based practice: you want to recognize the current state of your own practice, and you need to be able to believe that evidence-based care will lead to improved client outcomes. That is always our purpose when we're doing it. When we're involved, we're applying evidence-based practice guidelines or evidence-based practice interventions to our nursing daily tasks. It's always about the client outcomes. And even if we're making something easier on the nurses, that's going to improve patient outcomes, because if we simplify nursing tasks and keep them at the bedside more often and more readily available, then we have contributed to improved client outcomes. Some of the current perspectives is cost versus quality. Is the care that people are receiving, we're receiving high cost, we pay high dollars for our healthcare costs in the United States. Are we receiving the quality that we should be receiving based on those costs? There are individual differences. Every person's individual. We look at every care plan individually, as you know, and particularly in community health, in home health, and in hospice, is very important. In hospitals too, that we approach those individual differences for patients, families, and communities. And we want to make sure that we apply the appropriate evidence-based methods for community-oriented nursing practice, things that we know that will work in the community, like our windshield survey that we talked about, or certain types of surveys, or that we work with groups to do patient education. Those types of evidence-based practice methods that we know that work in community-oriented nursing practice. You want to learn the barriers to evidence-based practice for your work setting and become a or the solution to nursing problems. So you want to be a part of that solution, and you got to always take into consideration, for example, the age, mobility, and interest of clients when problem solving in the community. An example of that would be if you came up with an intervention, you did a study in the community, and you found that you needed to do some education with the older adults, and you decided that the use of computer games would be a good idea. Well, this particular group of older adults, they don't really own home PCs, or theirs are quite old and dilapidated, or they just have no interest at all in computer games, as much as persons who are younger and who have the economic means to own current technological equipment. And you may have elder adults who have iPhones and who would prefer to do that, but that is just for that particular group. You find that out. Okay, current perspectives. There are rising costs in healthcare. What that equals is continued challenges of finding resources to implement evidence-based practice. So you've got to be able to afford whatever you decide to put into place. We may decide that we need a particular pressure reduction mattress in our home health agency, or in our hospice agency, that the agency has to provide, but we can't afford to do that. So that we might have to come up with another plan for our evidence-based practice. Emphasis is always on quality of care and equal distribution of healthcare resources. We want to control cost if we possibly can, And also, to know that, the use of the internet is just absolutely very valuable and powerful way to look for the evidence of data, because it is, that's one of the ways that we disseminate data. We get it out there on the internet, and they're very usable and user-friendly and easy ways to access evidence online through the CDC, through clinicalpracticeguidelines.gov. I mean, there are a lot of different places where you can go and look for clinical evidence-based practice. Healthy People 2020 that we talked about, that came about in 1979 and continues today. They offer a systematic approach to health improvement for all age groups, many different disease processes, and many different health problems in the community. And they help provide a general direction and focus for measuring the progress of improving health status within a specific amount of time. They look at it over a period of 10 years of time, and sometimes they break it down into shorter periods of time that we would like to see the amount of older adults increase their mobility in the community. I don't know if that specifically is one, but they would look at objectives for, I know that is true for younger persons, objectives for improving clients' understanding of the evidence-based practice as well. The Minnesota model is something, as I wrap up this lecture, the Minnesota model was developed by the Minnesota Department of Health nursing staff, and it aimed to develop a model of public health nursing with the interventions. And I've posted this model out on the internet under this week, and the model received input from the public health nurses, clinicians, educators, and the national expert panel. And the final model defines the scope of public health practice by the type of intervention and the client level of practice. And I gave you I gave you a handout that has the specific definitions for this Minnesota model. And the 17 different interventions were identified in here. And this is what you'll see here, but you have the definitions that are posted in D2L for that. And finally, the Minnesota model actions. For each intervention listed in the previous slide, the following actions are taken. The intervention is defined, the assumptions about the intervention are given, and then practice examples are given for the specific type of client. Now, how the intervention relates to the other interventions also is explained. And basic steps are given for implementing the intervention, best practices are explained, and then the evidence is used to develop the intervention is then given. So that is the Minnesota model, and you have some additional handouts on that in addition to what you might read in the book regarding the Minnesota model.